Jamie Halcrow-Johnson.
I would like to refer members to my register of interests, in particular to the fact that I'm a registered mental health nurse, currently holding a registration with the NMC and my honorary contract with Greater Glasgow and Clyde NHS. As a mental health nurse, I know firsthand of the challenges our NHS faces and the pressures that it is currently under. But my experience of our health service puts me in a position whereby I can truly argue that it is this SNP Scottish Government which is best placed to tackle these issues going forward. The Audit Scotland report makes it perfectly clear that demand for health services continues to rise and that previous approaches of treating more people in hospital is no longer sufficient, and nor is it the treatment option that most patients want. The report highlights that the Scottish Government are already transforming the healthcare system by moving more care out of hospitals and into community settings, and it also makes clear that integration authorities are beginning to have a positive impact on the care of the people they serve. Delayed discharge, like most of the issues facing our NHS, is not unique to Scotland, but it is highly encouraging that this Scottish Government are taking decisive action to tackle this. For example, the Audit Scotland report points to a substantial 22% reduction in delayed discharges in Aberdeen City, which they attribute directly to its health and social care partnership. At this point, I'd like to commend NHS Lanarkshire's Hospital at Home project, which spans both North and South Lanarkshire health and social care partnerships. As an alternative to Hospital at Home's multidisciplinary team, which includes consultants, advanced assessment nurses, allied health professionals and community psychiatric nurses, delivers specialist and comprehensive care to frail older adults in their own homes. Research shows that most older adults would prefer to remain in their own homes where possible, so this service not only facilitates patient choice, but it also allows them to be cared for in a way which is safe and effectively reduces unnecessary hospital admissions. Audit Scotland's report recognises that the reforms this government are currently implementing, in particular in the area of the integration and health of social care, which includes mental health services, will ensure that our NHS is able to deliver against the increasing demand that it faces. Presiding Officer, I've been a mental health nurse for over 30 years, and in that time there have been many periods of transformational change. Over the years, we've seen huge changes not only in the way that we view mental illness, but also in how we care for and treat people who are suffering from mental illness too. And I was pleased to note that earlier this month, a report from the Mental Welfare Commission found that the number of young people with mental health problems in Scotland who are treated in non-specialist wards has fallen by more than 40%. Now, this reduction was so significant, it was acknowledged by the Conservative spokesman on mental health, Annie Wells, who actually tabled a motion highlighting this, and that motion was signed by 12 of her Conservative MSP colleagues, and by some on these benches too. Presiding Officer, it makes a welcome change that the NHS isn't being used as a political football, and that actual cross-party support can be found on this subject, if not others.
Will the member take an intervention?
Yes, Mr Cole-Hamilton.
Alec Cole-Hamilton.
I'm grateful to the member for taking an intervention. I absolutely share the support of Conservative benches on that motion and indeed the results that were contained therein. But what would the member say of the Freedom of Information request that the Liberal Democrats published just last year, which showed that some children are waiting up to 2 years in some health boards for first-line treatment from child and adolescent mental health service?
Claire Hockey.
If the member listens to the rest of my speech, I address some of those issues. The Mental Welfare Commission also highlighted a substantial decrease in the number of admissions of adolescents, attributed in part to the expansion of the Children and Adolescent Mental Health Services, commonly known as CAMS, and in particular to the service's intensive home treatment teams. Because of this service, young people are able to stay at home with family, remain in contact with friends, and continue to attend school while at the same time receiving care and intensive interventions and treatment that they need from a dedicated team of mental health crisis practitioners. During such an acute episode of illness, the maintenance of emotional and social contacts with significant people is hugely beneficial to recovery, and it shows just how vital CAM's investment has been to improving patient outcomes. Presiding Officer, spending on mental health has increased by 42.6% under the SNP, and in 2017-18, for the first time, NHS investment in mental health will exceed £1 billion. Over the past 7 years, almost £20 million has been invested to increase the number of psychologists working in CAMHS, and this has led to an increase of almost 60% of psychologists working in the specialism. In fact, the number of professionals working in CAMHS has increased by 50% in the last decade, an investment in the future of our youth, but also in our NHS staff, to whom we all owe a huge debt of thanks for the work that they do. I do not dispute that there are issues that the Scottish Government will have to work on. And as Audit Scotland report references, however, there are a lot of positives that can be taken from the report too. But improving the nation's health in the long term requires more than acute care. Unfortunately, there is no quick fix. There's no quick fix in Northern Ireland. There's no quick fix in the NHS Tory-run in England. And indeed, there's no quick fix in the Welsh Labour-run NHS either. However, the Scottish Government are implementing the reforms we need here in Scotland, and we are seeing the positive changes here already. Good quality healthcare is the cornerstone to a decent society, and we in the SNP will always strive to provide this for the people of Scotland.
Thank you. I call Jamie Halcrow-Johnson.